Good evening and welcome everyone. Tonight we are excited to host Mayo Clinic Florida's third annual virtual residency open house. My name is Liz Mauricio. I'm a neurologist on our campus here and program director of our adult neurology residency program, and I'll be serving as your MC this evening. So as we are gearing up for another virtual recruitment and interview season, the hope is that this event tonight will shed some light on what Mayo Clinic Florida is all about. And I'm going to introduce you some of our leaders here and some of our trainees on campus. So we'll have a general session covering a lot of different hot topics in residency training, and that will be followed by breakout sessions with each of our residency training programs. I'll ask that just a few housekeeping things that you remain muted during the general session. And if you have any questions along the way, we might have time for Q&A at the end, but probably not, because we have a pretty intense, exciting lineup for you tonight of speakers. So, but we will get to them, save them for the breakout sessions that will immediately follow the general session this evening. And you'll see at the end of our general session, you'll see some options to join different breakout sessions. And we have a media team helping us tonight. So if there's any problems navigating, they should be able to guide you to the right room. So as I mentioned, we have an exciting lineup of speakers tonight. And I'd like to kick off the evening by introducing Dr. Margaret Johnson, who's a pulmonary critical care physician on our campus and Dean of Education at Mayo Clinic, Florida.
Thank you, Dr. Mauricio. Good evening, or good afternoon, or good morning, everyone, depending on where you are in the world. Welcome to Mayo Clinic, Florida. I'm so happy you took the time to join us tonight. Thank you. I'm so excited for you to learn about our residency programs here, because I'm very proud of them. As Dr. Mauricio mentioned, my name is Margaret Johnson, and I'm a pulmonary and critical care physician. And in addition to that, I serve as the Dean of Education of the Florida campus of the Mayo Clinic College of Medicine and Biomedical Sciences. I joined the staff of Mayo Clinic right after completing my fellowship training. And it's hard to say this, but that was 26 years ago. At that time, I knew nothing about Mayo Clinic. I hadn't trained there. Quite frankly, I didn't even know Mayo Clinic existed here in Florida. Even though it can honestly be said, I'm not always the quickest learner. Within a very short time of my arrival to the Florida campus, I came to understand what a gem I had really stumbled upon. And I knew Mayo Clinic was where I should be. The reason for this feeling was and remains pretty simple. Mayo Clinic allows me to be the best physician that I can possibly be. Probably similar to many of you, I became a physician to help patients, both individually in our direct patient contact and collectively by research and education advances. Mayo Clinic's primary value, the needs of the patient comes first, guides all that we do here. It's that philosophy that allows me and all of our staff to singularly focus our efforts on doing the right thing each time, every time for our patients. This singular patient focus holds true not only for clinicians, but for our researchers, our educators, and everybody within the organization. For me, there's no better feeling at the end of the day of knowing I had the opportunity to be the best physician I could be to serve my patients. So what's all that mean for you as a potential resident at Mayo Clinic, Florida? And I think to answer that, we have to look back a bit. Over 150 years ago, our founders, the Mayo brothers, Will and Charlie as we know them, recognized that to provide the best care to each patient and to move medicine forward, the sharing of knowledge was critical. They brought physicians from around the world to their practice in Rochester, Minnesota to learn from them. And then they traveled around the world also to learn from others. With this practice as the foundation, medical education has remained central to our identity, who we are as Mayo Clinic. Mayo Clinic collectively has the largest GME program in the world. Across the enterprise, we educate about 1,900 trainees per year, about 280 of whom are here on the Florida campus. Certainly more important than quantity, however, is quality. And although I must admit I am biased, I'm incredibly proud of all of our training programs and all of our residents. We have phenomenal trainees, all of whom make Mayo Clinic a better place. Our residents are central to living our primary value, and for them to excel, each of our programs must be excellent. They must excel. And in that spirit, I can state with full honesty that all of our training programs are committed to providing every resident the best learning environment, a full, robust array of experiences, and supportive guidance to maximize his or her potential in a compassionate, team-based setting. I'm proud to highlight that many of our former and current Mayo leaders, including many who are on this call, are graduates of our training program. That speaks volumes. Thank you again for sharing your evening with us. I'm confident that you're going to find tonight's session very helpful and informative. I realize that figuring out where to go for your residency, it's tough. And not being here on campus only adds to that challenge. I hope tonight's experience, although virtual, gives you a good flavor of our campus here at Mayo Clinic, Florida, and what it means to be part of the Mayo family. I sincerely hope that each of you find your home for residency, just as I found my home here a quarter of a century ago. I would love to have the chance to welcome each of you to our training programs next year. Thank you so much for your time, and I'll turn the floor back over to Dr. Mauricio.
Thank you, Dr. Johnson. Our next speaker this evening is Dr. Leslie Simon, chair of our emergency medicine department here and medical director of our simulation center, which she's going to tell us all about.
Thank you. I'm going to share my screen and make sure. Can everybody see that? Let's see.
Yes.
Okay. And yes, I have the privilege of being the medical director for the Experiential Learning Center, which is my absolute favorite part of my job. The Simulation Center opened in 2013 from a very generous grant from the Weaver family when they sold the Jacksonville Jaguars. And part of the stipulation of the gift was that we would become a resource, not just for Mayo Clinic, but also for the community. And it's really cool because you can see everything from high school kids and local EMS to Tier 1 military forces and the elite medical teams that take care of the SpaceX astronauts training in the Simulation Center. We also have a procedural skills lab that added another 2,500 square feet of space, and this allows for training on cadaveric and animal tissue. And we're continuing to grow. We're adding a skull-based lab that will be used predominantly by ENT and neurosurgery, and also adding an advanced imaging lab in the near future. This is our task training room and some pictures of some of the trainers that we have available. And this is something that is open to trainees at Mayo Clinic 24/7. So your badge will open this room. So if you decide you want to practice on central lines or ultrasound training or endoscopy or the Da Vinci robot or laparoscopy on the middle of the night or on the weekend, you have access to this facility. We also are in the process of adding a virtual reality lab and augmented reality lab. So that'll add some really exciting new technology to our simulation center. This is one of our 3D printers. So if you don't find the task trainer you want, you can print your own. And we've had some really creative uses for this. We even had a neurosurgery resident who would print the more challenging cases and then go up and practice them himself in the Sim Center. This is the anatomage table, and this was created to be a virtual cadaver, but we use it a little bit differently at Mayo Clinic in Florida. We actually use it to load actual patient images from our PACS system so that you can look at the images from all different angles and dissect them. It's used for surgical planning, but it also can be used for presentations. We employ a large group of incredibly talented standardized patients in the Sim Center, many of whom are professional actors, and they really add to the fidelity of our simulation offerings. They can play patients or family members or other members of the healthcare team, and they're a lot of fun to work with. We also have some true experts in moulage who can create some injury patterns and pathology that looks like it belongs on a Hollywood movie set. We have several high fidelity simulators. This is Victoria. She's our pregnancy simulator, and she can deliver a breech baby and then have a postpartum hemorrhage and an eclamptic seizure while you resuscitate her baby with a IO and an intubation. So it's a great way to train. We are accredited through the Society for Simulation in Healthcare, and we also have a one-year simulation fellowship and have had several fellows who have remained at Mayo Clinic, Florida, or gone on to do great things in other places. In addition, we have an elective for residents, and this can be 2 weeks or a month long, and it's a great opportunity to patch your procedure logs and learn how to use simulation for teaching. We do several different types of in situ simulation. This is my favorite, and this can be everything from ambushing the emergency department with a patient that looks like they have monkeypox to working at Cape Canaveral on the launch pad practicing for mass casualty. We also offer faculty development courses, and these are for your faculty, but also for residents to learn how to use simulation. And they're popular with our rising chief residents because they incorporate quite a bit of simulation into their training programs. We offer debriefing workshops also. I find that debriefing is a great life skill, and you use it not just to teach in simulation, but also in your practice and in your life. I spend a lot of time now debriefing my teenagers. These are some examples of courses that we've offered in the Sim Center. There are so many different options and different offerings that there really isn't any limit to what you can do up there. This is my email here, and also Jean Ritchie, who's my administrative partner, if anybody has any questions that we don't get to today, and then a link to our website, which is currently being updated. So if you get frustrated, give us time. It'll be really good once we get it updated soon. So I appreciate your time, and thank you so much.
Thank you, Dr. Simon. I can't say how much our residents really enjoy their time in the simulation center. It's a real huge bonus for all of our training programs. All right, next up, we have Dr. William Palmer, actually a graduate of one of our residency programs on campus here. He is a gastroenterologist and associate director for education and in the Center for Individualized Medicine. Dr. Palmer.
Hello. So thank you, Liz. Again, my name is William Palmer. I'll give a little bit of background on myself, and then I'll talk a little bit about the Center for Individualized Medicine, also known as SIM. So I'm originally from South Carolina, and when I embarked on my journey to find a great residency program, I stumbled upon Mayo Clinic, Florida, and I knew from the moment I stepped on campus that that's where I wanted to be, and was lucky enough to train there for internal medicine, and then stayed on for GI fellowship and transplant hepatology fellowship. Joined staff 6.5 years ago now. So I want to echo one thing that Dr. Johnson mentioned, and that's just about we really are a family. I know that gets thrown around a lot, but Dr. Johnson taught me how to do blood gases, and Dr. Tyler, who's on there, is on here somewhere, you hear from in a few minutes, he taught me how to do lumbar punctures. Dr. Porter, you're going to hear from in a few minutes, was my chief resident. And Dr. Zaver, who's one of our chief residents now, is one of my mentees as he goes into GI fellowship. So the circle is unbroken. It's a really wonderful place and a wonderful family atmosphere. And I'm delighted to have my career here. So the Center for Individualized Medicine is one of the several centers that Mayo Clinic Enterprise has. And the charge of the center is to foster genomics and personalized medicine research and translation into practice. So I serve as the Florida Director for Education. So it's my job to educate not only our students, our faculty, our patients on things that are related to personalized and individualized medicine. There are a number of different educational offerings that we have. We run courses. We have a very successful podcast series. We do online webinars, all kinds of educational opportunities. As it relates to you all, I would say that there are 3 areas that you could get involved with SIM if you join Mayo Florida as a trainee. The first is pharmacogenomics, so PGX. Pharmacogenomics is the genetic study of how medications are metabolized by you individually, and how you would metabolize a different medication compared to someone else you know or another patient. And that's extremely clinically relevant when it comes to determining the right dose of the right patient at the right time. So if you were to go for our PGX pharmacogenomics elective, you'd complete some online didactics. You would work in the clinic with our clinical pharmacists to see patients, understand the patient's reports, understand how to counsel those patients. And that's an extremely valuable piece of information that you can have as you move out into clinical practice. The second piece would be clinical genomics, and you have the opportunity to work with our clinical geneticist in the clinic, seeing patients. We run a rare and undiagnosed diseases clinic. So basically Dr. House, if you've ever seen that show, if patients come and they have been ill for an extended period of time without a diagnosis, we perform whole genome sequencing. We perform a variety of genetic surveillance tests to try to isolate their condition, especially if they have a familial genetic component. We can help with collaborating and getting the entire family worked up. And that's something that you can be a part of in that clinic. The third area is if you have anything to do with cancer work, Mayo Clinic, especially Mayo Clinic Florida, is a national cancer referral center and has a big focus in high definition therapeutics and targeted treatments for cancer. So you would be on the front lines working with these specialists and researchers as they work to find individualized treatments and prevention for patients who suffer from cancer. So there's a variety of ways that you would be involved, more than you might see at many other places. And we're very proud of that. Many of our residents speak highly of the time they spend with us. The last thing I'll leave you with is it's no accident that my background is a sunny, windy beach. Just remember, you can choose a lot of places to train, but it's not bad to train somewhere where you can go to the beach every day. So I invite you to please reach out if you have any questions. And if there's a Q&A session, I'm happy to answer those. And best of luck on your upcoming interviews.
Thank you, Dr. Palmer. All right, our next speaker is Dr. Quinone-Hinojosa, chair of our neurosurgery department. And Dr. Q is going to share with us tonight a little bit about research and mentorship opportunities here on our Florida campus.
Thank you, Dr. Mauricio, and thanks everybody for being here. Dr. Mauricio asked me to, tackle 3 small topics. She said, tell them a little bit about your personal research background and interest. Number 2, tell them about the spectrum of research activities at Mayo Clinic, Florida, and opportunities for resident involvement. And number 3, tell them about mentorship for our residents at Mayo Clinic in Florida. So I said, each of those topics at a place like this is about an hour talk, each of them. And I'm supposed to make it in about 5 to 7 minutes. So I thought I'd start with 2 anecdotes. Number 1, I was thinking about it as I was listening to all the speakers, and I was looking at Dr. Palmer in the background and looking at the beautiful palms and the beach moving. I thought of 2 anecdotes. Number 1, why did I move? I left Hopkins to come to the Mayo Clinic in Florida. When I was a junior faculty at Johns Hopkins in 2005, I went into a meeting and I was put into a search committee for the new chair of neurology. And I was in a huge, gigantic room, and everybody was asking, what do we need to do next? And everybody's talking more research, more of this, more of that. And then another associate professor across me goes, we need to be like the Mayo Clinic. And I thought, oh my gosh, they're gonna fire him. And sure enough, the room went dead silent. Eventually, over the next 10 years, I served in 5 more search committees, and I saw how places like Hopkins had such an amazing amount of respect for the Mayo Clinic in such a way that when I had my first opportunity to come, I moved. And I did it, and I've been so happy ever since. The second anecdote is my wife. I did my medical school at Harvard, residency at UCSF, my first job at Johns Hopkins. Every single time that my wife went to those hospitals, within a few months with her and our children, she would leave, except when she came here. Within 6 months, she told me, now I understand why people from all over the world come to this place, to train, to understand what we do in medicine. And for that reason, she said, I will never be able to leave Mayo. So I'm a lifetimer, committed for the rest of my life. So these were the talking points. What do I study? I'm just going to show you a few slides. Cancer. Why cancer? Because these are the kind of questions that places like Mayo likes to tackle. We know that millions of people are dying. I love what we're doing in regards to research, education, dealing and feeding back to this principle of patient care. And I think when you see the 3 shields of Mayo, this place truly embodies all the values. And this is why, we're here together with you tonight, telling you a little bit about the work that we do. My own laboratory goes all the way from the operating room to the laboratory back to the patient. Over the last few years, working with mesenchymal stem cells, understanding the role of brain cancer, we have been able to not only understand the nuances of what makes cancer cells migrate and invade, but at the same time, collaborating with our friends in the Center for Regenerative Medicine, we were able to use the stem cells from fat as Trojan horses. So we use fat to fight brain cancer. So those are the spectrum, those are the laboratories that we really take a lot of pride in. We surround ourselves by giants, by people who do amazing work. When you look into the future, and what are the things that the Mayo Clinic is going to be doing and prioritizing over the next 5 to 10 years, we're talking about accelerating or development of drugs, particle therapy. We're right next to us. We're breaking ground for a beautiful, the first of its kind particle, not only proton, but also carbon, cellular profile, cellular and cellular biotherapeutics, procedural innovation. We have the Innovation Center right next to us and a tremendous opportunity to work with the Center of Individualized Medicine, the Center of Regenerative Medicine, of course, the Simulation Center, and of course, trying to create new therapies. I think that one of the things about this place, that we take a lot of pride is mentorship. And I go back to someone who was a migrant farm worker, just like I was when I first came to the United States. We like to dream, but we also like to persevere. And that's a common message that you're going to find from a lot of investigators, a lot of clinicians, a lot of scientists, and a lot of clinician scientists in this place. We like to think that we like to make sure that everybody finds their own niche, because if you do that, you are going to succeed and you are going to help us take care of the next generations. And we like to find cures. We like to give patients hope, and we like to make sure that anybody who comes here finds the right place to be. Why? Because it goes back to those principles. The brain is amazing. And I go back to the things that I know. We know how many neurons we have in the brain. We know how many synapses. Did you guys know that each one of your brains has more synapses than stars in the galaxy? So we like to think big, and we like to make sure that everybody in this place understands that, yes, to be great at something, one of the principles of mentorship is to recognize that you're going to be bad at it for some time. And we like to make sure that we're part of your life in improving your own. I leave you with this quote from the Mayo brothers, because we like to be surrounded by people with that vigor, that youth that allows us to keep dreaming. So thank you very much, Dr. Mauricio. I hope that I hit the 3 major topics that you wanted me to touch upon.
Absolutely. Thank you so much, Dr. Q. All right, next up, we have Dr. Emmanuel Gabriel, one of our surgeons here on our Florida campus. He's assistant professor of surgery, and he's going to talk to us about some of the innovations that are happening in the OR.
All right, I had to unmute myself first. Sorry for the delay. Let me share my screen again. All right, welcome everyone. I have the challenge of following Dr. Q. I think just some of the comments I have before I talk about innovation is I didn't do my training here, but whenever I talk to my residents, I tell them I wish I had done my training here. There's so much within general surgery that you have opportunities for. And there's such a breadth of cases. I can see from the sign up of this open house that I think the second most popular interest is in general surgery. So hopefully some of you can get some information about the areas of innovation that I'll highlight. And also this place is really like a family. You know, Dr. Q is mentoring me. I'm outside of neurosurgery. He's helping me with my own grants and things like that. And there are a lot of sort of these very prominent people here, but they're also very approachable, very humble. You know, Dr. Q didn't mention that he has a Netflix special. You guys can go watch that after this. You can watch the cutting edge, right, Dr. Q? I think that's what it's called. But I watched that. I forgot the title.
I'm not quite sure, man. I think it's made up.
You guys should watch that. I mean,
the surgeon's cut.
The surgeon's cut. Yeah. Oh my gosh, I watched it like 2 years ago. But yeah, I mean, it's like eye-opening to watch. You know, that he's here and he helps people within all different departments. So what I wanted to do is just highlight innovation within general surgery. So general surgery is broken down into these 5 divisions. We have advanced GI and bariatrics, colorectal, plastic, surgical oncology, which I'm a part of. I've been here for 5 years, and vascular surgery. And what might be interesting here is you don't see a division of general surgery. You will get general surgery training here. Dr. Ferris and Dr. Ellie will talk to you later. We do have acute care surgery. We all take calls, so you'll get all the bread and butter training that you need. But in addition to that, you'll almost have like mini fellowships within each of these divisions, because all of the faculty are fellowship trained. We basically all hold leadership positions within all the major surgical societies and are up to date with all the things that are happening. So a lot of folks are interested in technology, right? So Dr. Bowers, this is Dr. Ellie. They're within the advanced GI and bariatrics. They do almost everything minimally invasive and robotically. It was mentioned in our sim center. We have the trainers. We have 2 training consoles. Of course, they're shared with urology and some of the other subspecialties. But Dr. Bowers works a lot with what's called Mayo Clinic Ventures and business development. So we have on campus here and also in Rochester different business opportunities for surgeons. Sometimes residents get involved just to kind of know the ins and outs of how to create new products, patents, things like that. Dr. Bowers has patents on different surgical equipment like needle holders, things that he puts intracorporally to store needles, so he saves time not having to change the needles out all the time. And it's very interesting stuff. This is how Cologuard was set up. You know, Mayo Clinic's developed, and you can probably see commercials for the screening test for colorectal cancer all through Mayo Clinic Ventures. And of course, the clinicians who work here. And then Dr. Ellie has this really cool technology, is patented, where he is using magnets to insert feeding tubes. This feeding tubes can be very challenging in some of our patients, particularly those who have cancer. And it can be hard to do it minimally invasively. You know, we try to do it through small incisions to help recovery, minimize complications, but sometimes there's no windows for our GI colleagues to get to or our interventional radiologists to get to. So he's developing this magnet system to try to bring up the intestines to close to the anterior abdominal wall to help guide these tubes through in a much safer manner. We have very robust colorectal surgery team here. What I'm showing here is a procedure called PIPEC. So there is a procedure for patients who have carcinomatosis. It's a disease where multiple types of cancer may start spreading within your abdominal cavity. It's very hard to treat, can be very morbid. The standard of care is chemotherapy and a surgical procedure called HIPEC, which is sort of like a fluid-based, water-based chemotherapy bathing that's heated. And it's a procedure that I do and my partners do, but it doesn't always work that well. And so Dr. Murcia, he's this surgeon over here, in collaboration with colleagues in Europe, performed the first what's called PIPEC. So this is a gas-based, pressurized delivery of chemotherapy. And he was the first surgeon to perform that here in the United States. We're only like one of 3 centers that actually participate with this procedure. As you can imagine, it is very risky because you're pressurizing and aerosolizing chemotherapy in the operating room. You have to make sure there's no leaks or anything like that. But the results of this have been very promising. This is a clinical trial that I do using microscopes to image blood vessels in real time. So this is in collaboration with our GI colleagues, actually Mike Wallace, who's not here right now. He's leading the GI efforts over in Abu Dhabi Mayo Clinic overseas. But with his help, we developed this microscope, or use this microscope, and can actually image in real time tumor vessels at the time of surgery. We can see blood flowing through the vessels, compare the vessels to normal blood vessels, and then from that we make correlations with outcomes. And this is actually something that Dr. Q helps me with in the lab components. Plastic surgery is very, very active. This is Dr. Forte over here and his what he calls the PSORT team. They do a lot in innovation, not just basic science stuff. This is also in conjunction with Dr. Q. When he mentioned stem cells, he uses them to help regrow and regenerate flaps after large cases or burns, things like that. He has mouse models for this. They are looking into clinical trials for this. But then they also have more practical clinical innovation. So these are different artificial intelligence mechanisms and programs that they are trialing for patients. As you can imagine, with COVID, a lot of healthcare has become virtual visits. And so a lot of the communication is sometimes difficult to do if you're busy or, if it's after hours to get that virtual care. But with certain AI procedures, you can program the AI to address, hopefully, and triage common things that patients may have, if it's pain afterwards, nausea and vomiting, things like that. Dr. Forte is very active. I think in the last year or two, he's published about 80 papers a year. So he's very happy to take on new trainees. I'm within the Division of Surgical Oncology. We have a lot of basic science and translational research programs, as well as innovation. So this is Dr. Jacob. He used to be at Mayo Clinic in Rochester. And I think, like Dr. Palmer said, he saw the palm trees and I was going to get out of the cold for a while and finish up my career here in Jacksonville. But he does a lot with innovation, so many new technologies that he's trialing. We are part of one of 3 or 4 centers doing robotic mastectomies. I don't know if you ever heard of that. It still boggles my mind, why would you use the robot for a mastectomy? But there could be certain advantages that he's doing. This is something that I do breast cryoablation. This is also something on trial. It's not a common procedure that you'll find. I work a lot with our interventional radiology folks for patients who are not candidates for surgery, or who we try to generate immune responses in patients with metastatic disease. It's a very uncommon thing that you would find in residency. And then, of course, we try to integrate all of this with our clinical trials. So this is, again, the imaging in patients with melanoma and how we do the things in the lab. And you're certainly welcome to spend time in the lab as well. And last but not least, our last division is vascular surgery. I did it alphabetical, but vascular surgery, this is Dr. Young Urban. She has NIH funding to look at innovative and novel consequences of COVID-19 on blood vessels in the brain and also in the heart. And then she leads 2 trials that look at different types of technology for grafts, as well as artificial blood vessels, which is really cool stuff. So that I'd also like to just leave you with the fact that Mayo Clinic is really integrated with the other sites. A lot of our residents will actually travel to Rochester to do sub-Is and sub-rotations and things like that. So you have a lot of resources and innovation at your disposal. And with that, thank you very much.
Thank you, Dr. Gabriel. Our next speaker, I think, is wrapping up a middle school open house with one of his kids right now. So we're going to switch the order. And next, I'll introduce Dr. Tyler Vadeboncoeur, one of our emergency medicine physicians and director of our Trainee Wellbeing Campus Council here on our Mayo Clinic, Florida campus. Tyler?
Hi there. Thanks, Liz. Thank you guys for being here tonight. It's obviously you guys are super busy, so to take your time out to hear about Mayo's programs is phenomenal. We're so happy to have you. And just to add on to what Dr. Mauricio said, I'm the director of learner well-being here at the Mayo Clinic in Florida. I've been in that role for the past 4 years. And I've also been here since almost immediately, not quite, but almost immediately after residency. So I've been an emergency physician here for the last 16 and a half years. So Mayo Clinic, in terms of well-being, like in many other areas, has been a pioneer. Before well-being and healthcare was in the general awareness, Mayo Clinic was on it. What can we do about health, well-being and healthcare? So if you go to a national conference on well-being, you're going to see tons of content from the Mayo Clinic. You're going to see speakers from the Mayo Clinic. And oftentimes you're going to see other speakers who got their expertise at the Mayo Clinic and are now leading the well-being efforts at other institutions. All that being said, I think that the most critical element of well-being at the Mayo Clinic is its culture. Mayo has a deeply rooted values-based culture. So professionalism, collegiality, mutual respect, these things at Mayo they're foundational, they're baseline expectation. And as such, this sort of culture of being good people, being good humans, being respectful permeates and creates really a fantastic learning environment for our trainees. So research informs us that when trainees struggle or want or need support, they don't tend to go outside, they tend to go local. And what I mean by that is they tend to go to their peers, their co-residents, their chief residents, and they tend to go to their program directors more than outside resources. So Mayo Clinic has a fantastic, robust Office of Wellness and Academic Support. It's sort of run, if you will, by the care resource managers who are the gatekeepers or the quarterbacks. They know all the connections, they know how to get you to resources that you need. There's the mental health counselors, there's the disability and accommodation specialists, and there's also the academic support advisors. But despite the strength of that group, I think even more important is the deeply embedded culture of well-being in each of Mayo's residency programs. Because you're going to, when times get tough, you go to the people you know. So it's super important that those people are involved and care about your well-being. So at Mayo, attention will be paid to your well-being throughout your experience. Your PD, your program director, your assistant program director, your chief residents, perhaps your mentor will all be paying attention to your well-being. Your program will likely have a leadership role for a resident in the space of well-being. So resident wellness officer, some title like that. And that might be something that you'd be interested in should you come to a program here. We have the Mayo Clinic Fellows Association, which is the student association, if you will, or the trainee association for residents and fellows. And one of the primary roles of the Mayo Fellows Association is to look out for the well-being of our trainees. We have a free site. You just heard about the sites collaborating. So Arizona, Rochester, and Florida have a free site, GME, Graduate Medical Education Wellbeing Subcommittee. We also have a Florida Learner Wellbeing Council, which has 8 residents representatives on it. And basically the residents come and share with us what's going on in the learning environment. And then we try to help make changes where they're needed. And we also support residents in their own sort of well-being projects. So I think that's basically it. I think at Mayo, you are, as you probably know, you're going to get phenomenal training. And you're going to be able to do that in an exceptional learning environment. And if you're interested in the space of well-being, you will absolutely have opportunities to lead in this space. So hopefully that was quick in the interest of your well-being. But thanks for listening, and I look forward to hearing more from you guys.
Thank you, Tyler. All right, next up, I'm going to introduce one of our Chief Medicine residents, Dr. Zaver, and he's going to share with us what it's like from his perspective being a resident here on our campus.
Thank you, Dr. Mauricio. Share my screen here. Great. So hopefully you guys can see my PowerPoint. Well, welcome everyone. My name is Himesh Zaver. I'm one of the chief medical residents. Unfortunately, one of my colleagues, Dr. Jamie Kaplan, one of the chief surgical residents, had clinical Can you guys hear me?
Yeah, I think you're I think you're back now.
Oh.
Himesh, I actually just was able to jump on as well.
Oh, okay. Sorry about that. Like I was mentioning, unfortunately, Dr. Jamie Kaplan, one of the chief surgical residents, is unable to join us today due to clinical responsibilities, but she gives her regards and wishes you all best of luck in the interview process, and hopefully we can get you guys on campus here soon.
Himesh, can you hear me?
I can hear you all. Can you guys hear me?
Hey, no, I'm Jamie's here. I just got out of the OR, so I'm here now.
Oh, hey Jamie. I think we're on. Did you want to lead the session?
Yeah, here, I'm getting my webcam up now. So let me see if you guys can see me.
Okay.
But I can start anyway. So hello, everyone. I am Jamie Kaplan. I'm one of the fourth year general surgery residents here. And so I'm going to help Dr. Zaver kind of go through this. So the first standpoint we're doing is just talking about the trainee space. So obviously, if you come to campus, you're going to be able to see just the amazing infrastructure that Mayo has. But in terms of trainees, we really have the best of all spaces. So Mayo Hospital is a large hospital. We have 8 floors right now. We're actually working to add another 5 floors within the next few years. We have the Candidate building as well, which houses some of the oncology units as well as some other surgery departments over there. We have the Davis building, which actually it uses more for clinic settings. So in terms of like as a surgical resident, you're over there quite a bit for clinic, and I know you're over there for clinic for other specialties as well. The Mangurian building, which also offers a lot of different care for patients, and it also has an unbelievable cafeteria for food. And then the Stabile building, and that's some of the pictures that you see up here. The Stabile building is one of the best buildings, in my personal opinion, for trainees, because it houses the simulation center, which is where you can do a lot of your training. And then it also has the library, and it has these spaces on the bottom of the screen. You can see these are lounges specifically for residents that have food and have computers, and it's just kind of a good place to just come and relax if you have some downtime or to study, or whatever the case may be. So these are really wonderful spaces for us. In terms of the training environment, I mean, I can only speak for myself, but I absolutely love it at Mayo. I mean, it is truly a family. You may hear that from a lot of different people, but my surgical residents are, totally my family, 100%. And we work really close with other specialties. I mean, today I'm probably talking to about 5 different specialties on my patients, and we really work really close together. A lot of the times your patients are going to have a multidisciplinary approach with multiple teams kind of weighing in, because we have, complex patients here. And so it's really, really nice to know your co-residents, even from different fields, and we really collaborate quite well with each other, and we get along really well. So you can see up there on the top right is a picture of us in the OR, and then some pictures, I think, of some of the other resident teams down below. And we try to have as much fun as we can in the hospital while working. So here, just to kind of touch base a little bit on our simulation center. So this is, like I said, on the 8th floor of the Stabile building, and I think it's probably one of the best qualities of our program. We get in there quite a bit as surgical residents, but as medical residents, I know they go in there quite a bit as well. And it's really our time to be able to, work on suturing, work on cadavers. We have practice models for, practicing colonoscopies and EGDs. We really are able to work on our skills outside of, actually on live patients. And so I think that's a huge benefit for us. And so we also have actual areas in the simulation center that are basically like a practice scenario situation with a clinical patient. So we can have someone in the other room talking and, acting things out, and you as the provider have to go in there and kind of figure out what's wrong. And you have a set of vitals on the board, and you have a patient, and you're trying to figure out, what's the scenario. And so it's really nice to kind of have that where you can have that practice not on actual patients all of the time. And so as you can see here, we have OR suites, ICU suites, ED suites, outpatient clinic scenarios, and then there's always debriefing afterwards to kind of talk through what you did and what are, where areas for improvement. But I think at least for us, I think the simulation center is one of our favorite places to be on campus. Here, so one of my favorite topics is food. I love to eat, and actually Mayo Clinic has actually a really excellent cafeteria for the employees. So you can see on the top left, that's kind of the entrance to our cafeteria. And then on the right, that's again one of our resident lounges in Stabile. And then the bottom left is a group of surgical residents just kind of eating breakfast together. So we get a meal plan every year. Dr. Zaver, you may be able to add what you guys get. I know the surgery residency gets, I think, a little under $1,000 a year for food. But it really goes a long way. I've never used my entire meal plan for an entire year. I always have money left at the end. But you get a meal plan. It's open pretty early in the morning. I think it opens up maybe at like 7 a.m. and then it stays open pretty late. And then when you're on call, these resident lounges are really amazing because if you don't have time to get to the cafeteria, there's always sandwiches and chips and everything stocked in there for you. So the cafeteria is just a great place to kind of get a little bit of free money to eat when you can, and the food's actually delicious. We have different areas in the cafeteria where you can have sushi, salad bar, soup bar, sandwich bar, wraps, and then there's always one area that every day kind of switches up, and sometimes you have bows, sometimes you have pad thai, sometimes you have wings. It's just kind of all over the place, but the food is actually really, really good here, which you can't always say for hospital food, so that's also a perk here. And then in terms of research, so you get 5 presentation trips annually. You get 1 local attendance trip every year, and then you get 1 general attendance trip overall. So you don't have to be presenting at the conference for your personal research, but Mayo will pay for one of your attendance trips just to go and learn, whatever the subject matter of that conference is that you're really interested in. You can go and just completely be an observer and a learner and kind of take in all that information, and Mayo will pay for it. So I think that's a really huge benefit, because Mayo really wants you, to be involved in research if you're interested in it, and the avenues are there. And so I think this is a great kind of benefit that we get. We also get $17.50 per trip, which goes a really long way. So there's usually never any issues getting to conferences and having literally the entire conference paid for you. And then we also get a laptop that's given to you at the beginning when you start, and it's with you for your entire residency, which comes in handy. I check up on my patients every night before I go to sleep, and I use that laptop. So it's really nice to kind of have that. But research is, available for you if you're interested in research here. We have a lot of attendings that do a lot of research and want to get residents involved very early on. And so we try to go to as many conferences as we can and present as much as we can. And I think that's also something that if you're interested in, Mayo does a really good job getting the residents involved early with. All right. And then, so living in Jacksonville, Jacksonville is a very large city by land. I think it's the largest city in the country. It's in my opinion, one of the best cities to train in, because you have an awesome hospital in Mayo, but then you also have the beach very, very close to you. So I know for the surgical residents, most of us live beachside. However, we do have some people that live over on the opposite side, which is on the Mayo side. A lot of people really enjoy, now that COVID is over, we're getting back into the swing of things of being able to actually maybe, hang out outside of the hospital, and we are able to go to the beach quite a bit. There's a lot of great restaurants that I think we'll get into later, but you're really close to the airport. You're really close to the beach, like I said, and there's honestly quite a bit to do in Jacksonville, and we're learning that now that we're able to go out a little bit more. All right.
So,
yeah, go for it.
So housing in Jacksonville is very affordable. You'll find that in terms of renting as well as buying. For example, me,
Yep, I think we still hear you. Are you still there? Oh, we may have lost. Dr. Kaplan, do you want to just finish that off?
Yeah, let's see.
Am I back on?
Yes.
sorry about that. But housing is very affordable. Most residents either rent or buy. So lots of options close to the hospital. You can't give a presentation without discussing the beach. Mayo Hospital is roughly 3 miles from the beach. You'll find that most residents after their shifts or on their days off will spend lots of time on the various beaches along Jacksonville. Jacksonville, I would say, is very ethnically diverse. And with that comes a lot of great restaurants that you can try after work. One of the unique things that Mayo Clinic in Florida offers is Food Truck Friday. And so roughly about once a month, you'll have various food trucks come on campus, and that offers like a nice break in the middle of the day just to go check out some of the local food options in Jacksonville. And if you're into trying local breweries, the Jacksonville Ale Trail is a great option along the beach. Different breweries and restaurant options. Most of them are dog friendly as well. In terms of entertainment, lots to do in terms of music events, sporting events. Jacksonville is home to the Jags. It's a building year. Hopefully they'll be able to compete in the AFC South this year, but lots of minor league sports teams as well. In terms of soccer, Jacksonville Armada, minor league hockey with the Jacksonville Icemen, and baseball as well with the Jacksonville Jumbo Shrimp. In terms of humanities, Mayo Clinic puts a huge emphasis in producing well-rounded physicians. Most of the programs have some form of a humanities and medicine curriculum. If you look here on the left, these are some of our internal medicine residents participating in meditation during a protected humanities and medicine session.
And that you would have to reshare your slides.
Sorry about that. Are you guys able to see my slides?
Yes, thank you.
So this is what I was mentioning with our humanities and medicine curriculum. Lots of diverse things to do in Jacksonville, the Cummer Museum, the Riverside Arts Market on the weekend. So your days off are definitely spent in the community. In terms of intramural sports, a lot of the residents spend a lot of time together, and it's easy to find a pickup basketball game or a soccer game. And our Mayo Fellows Association does a lot to support some of these intramural activities. And with respect to our Mayo Fellows Association, I definitely want to give them a shout out. This is a resident-led group that really serves as our advocates to Mayo leadership and the various graduate medical committees here on campus. They do a great job of facilitating opportunities and events off campus. This was a top golf event that they did a little while ago, as well as keeping morale up in the hospital with just providing various treats throughout the year. And with that, I'll break it out back to Dr. Mauricio, but Jamie and I really want to take the time to wish you all best of luck during the interview trail, and we really hope you guys find the best fit for you, and hopefully it's here at Mayo Clinic in Florida. So feel free to reach out.
Thank you both to Dr. Kaplan, Dr. Zaver for sharing that resident perspective on life on our campus and life in Jacksonville. All right, last but not least, back from middle school open house is Dr. Ivan Porter, who's going to talk to us about diversity, equity, and inclusion initiatives on our campus. Dr. Porter?
Thank you. Thanks for the introduction. Let's see, I think you might be seeing a slide currently. Yeah, thanks for your grace. I did go to my 6th grade middle school orientation just now, and my daughter wouldn't let me leave until I met Miss Biello. So I left a little bit later than expected, but I'm here now. And I just want to briefly talk to you a little bit about diversity, equity, inclusion, and how we are developing a curriculum, how we inform that curriculum, and what we do with it. Do you see the presenter view, or do you see the regular display?
It looks great, thanks.
Okay, excellent. A little bit of history. History is important. You don't have to have an opinion about history. History is history. This is a picture from 1968 when Jacksonville was incorporated to make it that largest landmass city in the United States. So this is October of 1968. The mayor at the time, Hans Tansler, and a 30-year-old actress, Meredith Lee, who performed on Beach Boulevard at the Alhambra Theater, which still does dinner theater shows. So you'll see that over on Beach Boulevard. You can see Andrew Jackson, who Jacksonville was named after, Florida's first military governor, even though historians say that he never actually came to Jacksonville. What did he do for Jacksonville? You see the Timiqua territory there, these Native Americans that were there, and what is probably ruins underneath the area that you know as Amelia Island and in St. Augustine. But he signed the Indian Removal Act of 1830 that moved all of those Indians west of the Mississippi River in what you may at some point in schooling, depending on where you went to school, been told led to the Trail of Tears. But enough about Jacksonville, the naming of Jacksonville. You will all have an opportunity, those that interview in the future, to do what we call a second look, another open house that focused on diversity, equity, and inclusion, the things that I'm trying to talk to you about in the next 6 minutes. But it's a full program that also involved will involve one-on-one discussion, panel discussions with residents and their experience and fellows and their experience. And it's something that we're very proud of. It's on the list of the things that in this office that we are in charge of doing as far as targeted recruitment efforts, and a lot of acronyms. Office of Education, Diversity, Equity, Inclusion. They create and study. They are creating these targeted pathway programs. They are creating faculty development that is important for equity and inclusion and incorporation into our regular curriculums. And they are also involved in mentorship for retention of trainees to stay on our staff. Now, what about me? I'm the assistant dean for the Graduate School of Medical Education for all of our campuses. And so in our school, we take those programs that have been created, we execute them, and we also study. We study what the results are. We see what the efforts of that targeted recruitment actually brings for the clinic. We help to implement the curriculum and faculty development courses that are developed. That is our role. And just as an example, these are a number of the programs that we have that target both middle school and high school children, undergraduate, and then also medical and post-baccalaureate. And we are adding to these programs every year. My office is brand new. I just started this role in January. And so we've got a lot of learning to do this year and a lot of growth to be had. But again, working together with all of the other educational schools in addition to graduate medical education and that Office of Education, Diversity, Equity, Inclusion, we are able to kind of deploy these efforts. But again, one of the most important things we can do is use a scientific approach to make sure that what our goals are, what the objectives are actually being met. And if they're not, to change the process. It's one thing to have a feeling, right? But if you don't have data, your feelings are just that, they're feelings. And unless you can show a data-driven approach for success for your efforts, it's hard to justify your existence, in my opinion. Community engagement is what drives the ability to have a diverse education and equity education. And it's not the same thing as just reaching out to the community or talking to people at different events or just trying to recruit for our research studies. We have to build a reputation with the community. We have to build their trust. We have to partner with them and then show this ongoing connection. Community engagement is a passion of mine, and it doesn't have to look like you might expect community engagement to look like. It may be sending our residents to speak to the Florida legislature about how opiate prescribing laws may harm us as physicians. It may be about influencing those science and technology, engineering, mathematical discussions that occur at the high school level. But it also could just be a part of a vaccine task force. There are multiple ways to get back to the community, and all of it leads to equity in our community, and hopefully will help us inform diversification of the population at Mayo, which is very important to everyone that works here. One of the things that we've developed is a volunteer platform that basically allows us to connect everyone on our staff, including residents, including students, with volunteer opportunities, with outreach opportunities, and also to be able to catalog those things. Again, this is just another way to facilitate that connection and meet some of those objectives that from a with a DEI hat on are goals that we want to have met. We do that by performing a community health needs assessment. All nonprofit hospitals have to do this every 3 years. They basically, you know, the words are on the slide, but they go out in the community and they ask members of the community and leaders in the community, partnered with leaders of the hospital systems to state what the problems are. And they look at the data. What are the most common hospitalizations? What are the largest disparities in your populations? Where can targeted efforts actually make a difference with the health of the community with which we serve? Sure, a lot of those are based on socioeconomic factors. Some studies would say 40%, but there's so many other things that aren't healthcare related, that is not you walking in with a stethoscope, that play a role in someone's overall health. Our goal, both with the DEI curriculum and with the efforts that we use with community engagement, is to reduce those gaps, make a difference moving forward. I've got two slides left, but it's important to know information about the community that you serve. Mayo Clinic has a population that they serve in Duval County and St. Johns County. You can see from this slide that they are very different populations. And while we're in Duval County, we do have a lot of St. Johns County, which is very, very close to us, that represents a lot of our patient populations. And you can imagine that the needs of those patients are different. The expectations of those patients are different. And you as a provider have to learn how to exist in all of those spaces and be able to care for any patient. So hopefully by focusing on the value of diversity and what that brings to communities, that positions you to be able to provide healthcare for anyone with any level of resource. And if there are resources that are lacking, we can provide the tools to be able to find those gaps and fill them in. Lastly, I'll just show you what the themes for the community health needs assessment were. And they are often similar year to year. Mental health was at the top 3 years ago as well, but access to care, poverty, how we deal with chronic disease. Some of these may seem difficult to fix from your position, but again, together, partnering with the community, even just using your ideas is what allows us to be able to make an impact over time. You got to be willing to run a long race. I've been running this long race for a while, and hopefully you'll be able to run it with me soon enough. So welcome. Thanks for your attendance. Thanks for your attention. Sorry I was a little bit late and out of order, but Dr. Mauricio, back to you.
Thank you, Dr. Porter. And what I failed to mention when I introduced you is not only your position in DEI and that you're an awesome nephrologist, but also a graduate of Mayo Clinic Florida residency program here as well. So thank you so much. Thank you to all of our speakers tonight. We are out of time for a general session. Thanks, everyone.